Good morning, ma'am. I am Gabriel Alderida from BSN 13, and today I am going to perform a return demonstration in abdominal to neurological assessment. So when we say about abdominal assessment, it is the process of evaluating the abdomen for any abnormalities or changes in appearance, texture, or function. It involves inspecting, auscultating, percussing, and palpating the abdomen to identify any signs of pain, discomfort, or disease. So on the other hand, when we say about neurological assessment, it is the process of evaluating the nervous system to identify any signs of disorder affecting the brain, the spinal cord, or the nerves. So this assessment typically involves a physical examination to check the functions of nervous system, in which includes tests of reflexes, muscle strength, and sensation. So for the assessment, first thing first is to introduce yourself to the client and identify the client and explain the procedure. So good morning, sir. I am Gabriel Alderida, your student nurse for today, and I am from Aklan State University. So may I know your sponsor? Can you state your full name, sir, please?
I'm glad Zee.
Thank you, sir. So how about your birthday po?
September 20, 2003.
Okay. So what do you like me to call you po, sir?
Engineer.
Okay. So what is your preferable language to use po, sir? Okay. So thank you, sir. So today, sir, is I am going to assess your abdomen as well as your neurological status. So the diet, sir, ay para ma-identify if there's any abnormalities or disorders in your abdomen or in your neurological status. So this involves, sir, your physical examination. So is that okay to you, sir?
Yes.
Okay, so for the planning, we should first assemble the equipments needed. I have here an alcohol, a stethoscope, reflex hammer, a tongue depressor, clean gloves, pen light, and of course, scented materials. For the implementation, first, we should assess the abdomen. First is to inspect the abdomen for skin integrity. Also, inspect the abdomen for contour and symmetry. So, sir, again, sir, pwede ko, sir, maalsa imong lambong, sir, para matanaw ko imong atiyan, sir, imong abdomen. So, thank you, sir. Kinaog ko lang, sir, Next is to auscultate the abdomen for bowel sound. So in here, we will use a stethoscope. Then after that is to palpate the liver. The liver is located in the right upper quadrant. Sir, pwede ka mo, sir? Kapong ko, sir? Okay, sir. Thank you, sir. Lalag ko lang ito, sir. Now, we will proceed in assessing the musculoskeletal. So, first is to inspect the muscle for size. Also, inspect joint for swelling. So, Sir, pwede kumabitan, sir. Ano naman, sir? Then after that is to palpate each joint for tenderness, smoothness of movement, swelling, crepitation, and presence of nodule. So sir, again sir ha, i-inspect Then, palpate the bones. So, sir, movement mo lang, sir, ha? Now, let's proceed in assessing the neurological status. So first is to assess the patient's mental status. So, evaluate the patient's orientation to person, place, and time. So, sir, again, sir, do you remember me, sir? Okay, so, ano ako, sir? Sir. So, are you aware, sir? Sino ko makara, sir? So, anong oras makara, sir? 2 p.m. Yes, sir. Now, let's proceed and evaluate the level of consciousness of the patient. So, sir, pwede ko, sir, close your eyes. Open your eyes, sir. Again, close your eyes po. Thank you, sir. Kilala, sir. Kilala, sir. Kilala, sir. Sir. Then is to assess the memory of the patient, the immediate recall and the past memory. So, sir, do you remember, sir, when was the last time nanggaling ikaw? Sa school. So, ano po, sir, sa school, sir? Sa school lang. After assessing the neurological status of the patient, now let's proceed in testing the cranial nerves function of the patient. So first is to ask the patient to close the eyes, occlude one nostril, and then identify the smell of different substances such as coffee, chocolate, or alcohol. And repeat with other nostrils also. So sir, can you close your eyes, sir? So sir, can you, pwede mo sir, tabunan doon sa below sir, o sir. So I want you to recognize this sir ha, kung ano ka sir. Okay. So, okay, thank you sir. Thank you, sir. Then after that is to test the visual acuity and the pupillary constriction. Now we are clear, sir, ha? I want you to recite the letter, sir. Okay, what is this, sir?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, F, E, J, K, C, L, O, M, K, B, A.
Thank you, sir. At the letter over there, sir, ha? Just focus it, sir. Okay. Thank you, sir. Sir. Just look after, sir, just focus. Then, move the patient's eyes through the 6 cardinal position of gaze. So, sir, I want you to follow the motion of this pencil, ha? So, then after that is to ask the patient to smile, frown, wrinkle forehead, and put out cheeks. Sir, can you smile, sir? Can you do smiling? Okay. Can you do frowning? Okay. Can you do bubbly cheek? Okay. So, can you also wrinkle your forehead, sir? Okay. So, yes, sir. Next is to test the hearing of the patient. So, in testing the hearing acuity of the patient, we will test first the whispered tone of voice. So, I want you to follow what I'm saying, sir. Ha? So, extraordinary. So, wonderful. Then now let's test the normal tone of voice of the patient. Chocolate. Vegetables. Next is to test the gag reflex by touching the posterior pharynx with the tongue depressor. Explain to the patient that this may be uncomfortable. So, sir, makara sir is, gusto ko sir is bukon yung may mong baba, may gina-expect ako sa sulod sir. And gagamit ako sir tongue depressor, hara imong sir ho. And you may expect sir na this is may uncomfortable to you and pwede kang masuka sa daya sir. So, is that okay to you sir? Okay, thank you sir. Sir, can you open your mouth, sir? Okay. So, okay, can you lower your tongue, sir? Lower your tongue, please. Lower your tongue. Okay. After that is to place your hands on the patient's shoulder while he or she shrugs against resistance. Then place your hand on the patient's left cheek, then the right cheek, and have the patient push against it. So, sir, can you stand po, sir? Okay, sir. Okay. Pwede po dito, sir. Okay, thank you, sir. Okay. So, I want you to resist, sir, ha? Okay, the force that I'm going to exert. Okay. So, you can use it. Sir? Okay, sir, I want you to resist also the force that I'm exerting, sir, ha? Okay. Okay. Then is to ask the patient to close his or her eyes, place the familiar objects in the patient's hand and ask him or her to identify the object. Repeat using another object for the other hand. Okay. So can you open your palm again, sir? Okay, thank you, sir. So I want you to close your eyes again, sir. Okay. So identify what object it is, sir. Okay. This one, sir. Okay. Okay. Next is to assess the patient's deep tendon reflexes or DTR. So first is to in the patient's wrist, the antecubital, the triceps, the patellal, and the Achilles. Paan naman yun po? Next is to stroke the sole of the patient's foot with the end of the reflex hammer handle or the other hard objects such as the keys. Repeat it on the other side. Next up, sir. As needed, assist the patient to a standing position. Observe a patient as he or she walks with a regular gait on the toes, on the heels, then heel to toe. Okay. So, sir, I want you to walk straight and back forward. Sir, then after that is to perform the Romberg test. Ask the patient to stand straight with feet together, both eyes closed, with arms at side. Wait 20 seconds and observe for patient's weighing and ability to maintain balance. So be alert to prevent the patient's fall or injury related to losing during the assessment or during this assessment. So, sir, pwede ka, sir, tayo, sir. Okay. Thank you, sir. Can you close your eyes, sir? Okay. Can you also close your feet, sir? Okay, your hands also. Okay, thank you, sir. I will count 20 seconds, sir, ha? Okay, let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Okay, so thank you. After that is to reposition the patient. So, sir, balik sir. Okay, sir. Okay, and then sir. Okay. So, are you okay? Are you comfortable, sir?
Yeah.
For the documentation, I will document the procedure from start to end. Okay, so that's the end of my return demonstration for today. Thank you, sir.